So my name is Kirsty, and I'm going to talk about barriers to recreation and leisure for people with disabilities. So I did my practicum at Recreation Integration Victoria, or RIV. And RIV is a nonprofit organization designed to assist people with disabilities to pursue active lifestyles in the community in Victoria. And the two main tasks I did at RIV was to devise a literature review and to work on a project called the Leisure Access Victoria app, or LAVA project. So the literature review I created was about the effects of public perceptions and negative attitudes on participation rates for people with disabilities in recreation and community centers. And this was a qualitative and mixed method literature synthesis that I created. Before I go any further, I just would like to point out what I mean by disability. And often when we think of disability, we think mainly of physical disabilities. But in this paper and with the LAVA project, we tried to encompass all disabilities, so including cognitive, developmental, intellectual, and mental health, and other such disabilities we may not think of are chronic pain or autism spectrum disorder. And then for the LAVA project, I worked with a team, and we collected data on accessible features at recreation and community centers in Victoria. And then these accessible features will be put onto a website for the public to view and understand what the center will be like before they get there and what features will be workable for them. And both the literature review and the LAVA project look at barriers to recreation, but focus in different areas. So the literature review focused on societal barriers, and the LAVA project looked at barriers of the built environment. So before I go into detail on the two aspects of my project, I'd like to talk about why access does matter. As we know, physical activity is important for our health and well-being, and this is just as important for people with disabilities. And often, due to the nature of some people's disabilities, it may be that much harder to pursue active lifestyles, and therefore we should be giving as much access as possible to this. A study done by Rimmer and colleagues in 2004 found that 56% of people with disabilities don't participate in leisure activities, and that's represented in the first pie chart there, and that dark green segment is the 56%. And the pie chart next to it is showing people without disabilities, and only 36% of people without disabilities don't participate in leisure activity. So as you can see, there is a disparity there. So first, I will talk about the literature review and barriers, attitudinal barriers, and then after I will talk about the LAVA project and environmental barriers. So to create my literature review, I used key search terms into 4 main databases and resulted in multiple hits. But those were easily weeded out just based on title and abstracts alone. And then from there, I weeded out more papers based on certain exclusion criteria. So those were anything that was published earlier than the year 2000, anything that was published outside of Canada or the US, anything that had nothing to do with societal barriers alone, and anything that was a not qualitative or a mixed methods approach. And this left me with 14 articles to work with. 6 of these articles looked at stigma for physical disabilities, and also specifically for spinal cord injury, for mental health, and for developmental disabilities only, and no other disabilities were represented in those studies. And 8 looked at how these negative attitudes do affect participation rates for people with disabilities. So 3 main findings that I found from the literature review. The first one is that attitudinal barriers do exist, but it can change. Some of the studies found that it varies depending on type of disability. So some studies found that people with mental health or specifically schizophrenia may feel higher levels of stigma towards them than someone with a physical disability. A second finding I found was that the way people with disabilities deal with these negative attitudes toward them differ. So a study done by Riley Jr. and colleagues in 2007 found 3 main themes: that either the person would stay at home and try to reduce their contact with the public, Another group of people found that they would just ignore these negative attitudes and go out in the public anyway. And the third group would advocate for themselves and use it as a learning opportunity. So all three are not ideal, but the first one is also especially troubling, that people are further isolated in their own homes. And the final finding I would like to just touch on is by Keith, Rogue, and Bonetto in 2015. And they looked at the benefits of disability training and staff training, but also the quality of contact and interactions between people with disabilities and people without disabilities. And they found that it's not the quantity or amount of times people interact, but the quality of those interactions that matter the most, and that reduce some of these negative attitudes. So now I'm going to switch gears and talk about environmental barriers, and this was done through my work with the Lava Project. So my coworker Angie devised a checklist that we used based on the BC Access Handbook, and this was to look at accessible features in recreation centres and community centres in Victoria. And in addition to measuring some of these features, we would also take photos and videos of the sites. And this was to record accessible features and inaccessible features, but only the accessible features are going to be put onto the website. And we found that all centers actually differed in what type of features they have and what doesn't. There was no consistency, which is very interesting. Example of features we were looking at, I have here up on the slides. So the first one there is a push button. Everyone is probably familiar with that for opening doors. And we weren't just looking at that for the front doors, but also bathroom doors and change room doors. The second picture we have there is a sign with Braille, and this is for visually impaired individuals who can also read Braille, and this would help them to navigate around the center. And the final picture there is a fire alarm with the strobe lighting. So this is for people who have hearing impairments or who are deaf that wouldn't be able to hear the fire alarm. And the strobe light is a visual warning for them. So those are just some examples of features that we would be looking for. So in addition to putting these accessible features on a website for people, we also, my partner Angie and I, worked on recommendations for the rec centers and the community centers based on gaps that we found. And this is an example of an infographic we worked on that's just looking at the pool alone, and these will go out to all rec centers in hopes that they will fix some of the gaps and barriers that we found. And a quick example, the top corner there is a ceiling lift, and what we found in some of the centers that the ceiling lifts weren't in the chargeable position. So this is a quick, easy fix free for them to know, have regular checks to make sure that the ceiling lift is in working condition and in charging position. And then some of our recommendations range to also something that is more costly. So in the bottom corner there is a picture of a pool with contrasting pool tile edging. And this is to help people with visual impairments. They can see very clearly where the edge of the pool deck ends and where the beginning of the pool starts, and this is somewhat of a safety thing. Of course, something like this costs a lot of money and would require grant or municipal funding, but it is something that we would like to recommend to rec centers if they ever get the funding to do that. So in summary, there are barriers to recreation and leisure for people with disabilities, as I found in my literature review for attitudinal barriers, and the Lava Project we did find some environmental barriers. But staff training, disability training, and the quality of interactions can break down some of the barriers of negative attitudes. And hopefully our recommendations will help break down some of these environmental barriers. And this is all to the goal to have equal access to recreation and leisure for people with disabilities in our community. So quick thank you to my team at RIV and my LAVA team, as well as the professors here at UVic who helped me through my practicum. Thank you.
Questions or comments?
Hi. Did you find that the perception of cost related to access, like the facility, like not just, not the big improvements, did you find that as part of an attitude, somebody help me again. Attitude barrier to accessing the center?
The cost of accessing the center or the cost of
Yeah,
fixing
like the
center?
perception of, oh, well, it might be too expensive to access.
Yeah, that's a really great question. It's not something that I really went into depth with the project, but it is something that we probably will explore later when looking at programs and the cost of programs. So it could be a barrier, the cost for sure. Recreation Integration Victoria does have something called a Leisure Access Pass, which is to help some of these barriers. It's not for the person with a disability to get free access, but their worker, if they had one, to have free access. So there are some ways in which costs can be mitigated, but it's not perfect.
I have a question, if I may. So did you actually go out and look at the different recreation centers?
Yeah, all in the Greater Victoria area. So we went out in North Saanich all the way down to the Oak Bay, all the community and main community and recreation centers.
So did you see me lifting weights or swimming at a squat mall? No, I'm kidding. Yes, I will. Okay, other questions or comments? Oh. Yeah, yep. Dwayne.
So I'm not so familiar if you have so I'm from Ontario, and we have the Ontario Disabilities Act to ensure that we have the appropriate resources to have access into community centers or workplaces. Is there something similar here in Victoria?
In terms of what? Sorry, is it like to make sure the sites are
well,
accessible,
that's
or?
because you talk about the barriers in community centers, and so to ensure that in Ontario, to ensure that there is, I guess, the financial resources put into place to help fill those gaps. So I was wondering if there is a similar act here in BC to assist with for the inclusion.
I'm not aware of anything like that in general. I do know that some centers do subsidized entry fees. For example, Move Adapted Fitness Downtown, they do subsidize based on income level. I don't think the general rec centers do anything like that, and I'm not aware if that is something that would be like provincially funded or anything.
Okay,
It's
thank you.
interesting. Yeah, thank you.
My younger sibling Gavin has shortened. It's called IDIG-15, and it kind of closely resembles a more like low functioning autism. And what we found was when Gavin was younger, we're from the Greater Victoria area. When Gavin was a younger kid, so you know that 8, 9, 10 age and younger, everywhere we would go, whoever was with Gavin would get in somewhere for free. So if it was swimming, I, as his guardian at that point, would get in for free with him. But now that Gavin is 19, we're finding places don't acknowledge that in the same way. So I think that's maybe in the future something to look at. He's 19 in July, and we're even finding now, people start asking for identification, and they start asking, and I'm like, well, it's kind of obvious. And there are some people where you can't physically see it at all. So I wonder what way to combat that, because it's hard, and it's hard for
Absolutely.
Gavin as well, being everywhere he goes, someone being like, is he special needs?
Yeah.
So, yeah.
Absolutely. That's a really great point you touch on, especially for people with like invisible disabilities, that a lot of people, there may be more stigma attached to that, or people don't understand. I recommend looking into the Leisure Access Pass for RIV, because that is for also adults as well, and for people that come with them. Yeah, great point, thanks.
Actually, Kirsty, you're not going to like this question because it's a little, well, anyway, and you might like it. I'm actually quite interested in this whole issue of perceptions and attitudes that you talked about. And I know that there are many members of the disability community, and I'm talking more about those with, let's say, cognitive challenges, who are very concern, for example, around Paralympics, where there's sort of stereotyping of, certain types of athletes. And I just wondered what you thought about that, or if you've encountered that type of disquiet, let's say, in people in the, with cognitive, and their families with cognitive challenges.
Sorry, so around Paralympic.
Well, in other words, the danger, Paralympics are great in the terms that we celebrate the physical prowess of athletes, but many are concerned that that's creating this sort of stereotype of all sort of super athletes, that type of thing, as opposed to not focusing on the challenges faced by those with, let's say, other non-physical disabilities.
I'm not too familiar with the topic that you're talking about. So if I get this correctly, you're asking about whether, because people with certain developmental disabilities may be more capable at doing some of the activities.
Well, it's just this projection of disability, and people think of these superheroes like the Rick Hansons and these people who are fantastic athletes in their wheelchairs or whatever.
Right.
And there's that. So when people think about disability, they're thinking about those individuals
right.
and celebrating that, and forgetting about all the other challenges that many other people with other disabilities have. That's the concern.
Right, that we're putting people with a disability on a pedestal because they have a disability, and we're making them. Is that that's
or
kind
that
of what
we're
you're,
creating this kind of stereotype?
Kind of, right. Yeah. Well, I mean, I would say maybe an attitudinal barrier in the other direction in a way. People with disabilities don't want to be, because they have a disability, that they're a hero, right? They're a person. And yeah, I think that if that's what you're talking about. Yeah.
Is there one more question? Yeah.
It was just a comment to Nigel. Right after this, I'm going to go hang out with my Paralympic rower friend. And a lot of the Paralympians, the only reason, not the only reason, but one of the reasons that they have the Paralympics is to put classified athletes on a scale of competition with other classified athletes. So in rowing, there's the able-bodied, there's trunk and arms, and there's arms and shoulder, based on the severity of their physical disability. The Special Olympics, completely different on a mental disability scale for, again, different classifications. But all of those sports have a different thing. So I think that trying to delineate the two, like a lot of people, when I've talked to them about my friend who's a Paralympian, they automatically assume that he is someone with a mental disability. He got into a motocross accident and has messed up legs, not, a full-blown mental disability. So I can agree with the perception, but I just wanted to delineate those two because it sounded like you said mental disabilities first and then went to physical disabilities, which is Paralympics. But yeah, I could see that being a very big difference for you, Kirsty.